So let's say PGT, in general, I'm positive about it. First, a quality healthy embryo. And how do you determine a quality healthy embryo? Preimplantation genetic diagnosis provides additional information that at least chromosomally the embryo is healthy. Here, of course, therefore, accordingly, when we do preimplantation genetic diagnosis on an embryo, we already, well, not 100%, but let's say 70%, maybe, yes? We can say that this embryo is of good quality, healthy. And this already almost excludes the embryo as a factor in case of failure. And if you transfer an embryo after PGD, it is easier for you as a doctor to analyze and think about what might be the reason for failure, if there is one. When it's a failure, then the question begins. And why did the genetically healthy embryo not implant in this patient? And they can just try to implant and wait until, or you can do PGD, yes, and immediately choose an embryo from the 5, definitely some chromosomal healthy one, and a higher chance on the first try. So it's a plus. That is, time is not lost, waiting stress, selection, yes, despair from a failed attempt, financial costs for the whole cycle, and so on. Yes, you seem to be paying extra money for PGT, but you overpay a little less later. So there are advantages to PGT. It is still a faster time to achieve pregnancy. It is a slightly higher chance of establishment overall if we compare PGD and non-PGD. So let's say PGT, in general, I'm positive about it. I think it's a tool that improves the overall effectiveness of IVF. But still, I think it's cool, neat, it's an additional tool, very important for patients who have recurring miscarriages, giving birth to children with chromosomal pathology, yes, definitely. So with unsuccessful, unclear attempts. So I often recommend doing preimplantation genetic diagnosis of embryos. I often recommend it because I see several advantages. It's not one massive advantage, but several benefits, aspects that, for me, they make the task a little easier both now and in the future if various options develop further. And in principle, it's a bit calmer, a bit more reliable, a bit easier, a bit safer for patients in terms of carrying and the health of the child.